Max, hello, good morning. We have 6 hours difference. Good mornings for you.
Thank you.
And may I ask you, how are you in this context of a pandemic?
So it's a very, very strange time. Fortunately for me, I'm used to working from home. So I'm used to being home a lot. But it has been very strange for my family as we've been together all day, every day.
Mhm.
And it's been up and down. I'm very worried about my family members who don't live with me. So it's just been a very, very strange time, but it also has been very illuminating in that it is exposing many of the weaknesses of the existing system of capitalism, of white supremacy, of patriarchy. So it's exposing a bunch of those weaknesses right now, and I think that is also very interesting. But this is a very, very strange time, to be sure.
Okay, you're living in Washington.
Washington, D.C., yes.
Yeah, Washington, D.C. Could you tell us what is the situation of people of African descent when we know that they represent more than 51% of the population of this city?
So now the population of people of African descent in Washington has reduced. So now it's
Oh,
about 45%. Uh,
because, excuse me, because of gentrification?
Exactly right. Washington, the prices in Washington D.C. have gone up extremely and have pushed out large numbers of people of African descent who now live in the suburbs in Maryland. So Washington D.C. is really a metropolitan area. Washington D.C. is a city, but it's not a state. It's the only
Yeah.
part in the United States that is not a state but is a city, and it
Like
is
Paris.
like like Paris, yes. And then it is bordered on southern Maryland, Maryland to the north, so southern Maryland, and northern Virginia. So the whole area is called the DMV, or DC, Maryland, Virginia. And a lot of lower income Black people were forced to move to parts of Maryland and even to parts of Virginia as well. So yeah, the total number of Black people in DC has reduced significantly. With that said, the situation is very difficult here because it means the Black people who remain here are disproportionately poor, even beyond what we were before, because now Washington is effectively a wealthy city. So the ones who remain are people who are living in public housing, and the city is trying to force them out, or who live in the homes that their parents or grandparents or great grandparents bought many, many years ago, and they're getting offers to sell them. So it's a very difficult social and political time for people who live here. And even though there are Black people who are in positions of power, the mayor, many of the city council members, it doesn't seem that they're acting with the interests of Black people at heart. And there's always complaints among Black people that we are not represented in the government, even though we are the majority in terms of the face. So there are these Black faces there, but there doesn't seem to be the action behind those faces to meet the needs of the Black population.
Regarding this number of population, even if it is reduced, do you know exactly the amount of African American or people of African descent losing their job during this period?
So we don't have the exact number. They haven't tracked it in terms of those numbers, and they haven't tracked all the numbers, but a significant number have lost their jobs. The only reason it's not worse is because a lot of people of African descent work for the government, either the government in Washington, D.C. or the United States government, which of course is housed here in D.C. So it's a lot worse in many other cities where we have a lot of service jobs, which we still do here as well. But I think the big places where we're hit are the service jobs, the waiters and the bus boys and people who are cleaning stores and other things like that. Those are where we really lost a lot of jobs. The government jobs here have been insulated a little bit, and the teaching jobs have continued as well. But other support staff in schools have been cut. So there's a lot of job loss. I don't have exact numbers, and they're not releasing them right now. But it is significant. We're going to start feeling a lot of pain here very soon.
And is there, from the state, is there some some aid from public?
So there is very little aid. The federal government was able to pass very quickly a bill that would give every person who made less than $70,000 a one-time check, not every month, just one time, for $1,200.
Okay.
Which of course is not a lot, but for people who need it, it is something.
Yeah.
But there are a couple factors. One is that this is the amount that is going directly to people, to human beings who make very little money, is not anywhere near the amount of money going to corporations. So really what needs to happen is people need to get that amount or more every single month, plus have other things happen, like you don't have to pay rent, or other things like that, and that's not happening right now. So what are we going to do to make that happen, I think is the question. The other thing is there's a lot also of problems with the way that the checks are going out. So one of the big problems, of course, is that the government also passes part of this, that if anyone owes money to a bank, the bank can take their check.
Uh-huh.
So if they owe money because they didn't pay a credit card bill or they didn't pay some other bill, the bank can actually take. So if the people who are the poorest, who are in the worst position, who have the most debt, are actually not going to get it, and this money the government is giving them is going to go directly to a big corporation, which is also getting their own bailout. So this is going to be a very bad situation for a lot of people.
Yeah, of course, and not surprising us.
Yes, not surprising.
What is the current situation in hospital in United States?
So it depends on the region. There are places that are completely overwhelmed, the hospitals. New York is one. There are areas in Louisiana that are overrun, but there are several areas that are called hotspots where there are a lot of COVID-19 cases where the hospitals are overrun. And there are not enough ventilators. So people who need ventilators, who really need it bad, or do not have ventilators and are not going to get it. And in some places, there are not enough beds. So there were instances in New Jersey and a couple of other places where people died in the hallway in the hospital. So not even in a room, because they couldn't get a ventilator, but they could not even get in the corridor. They could not even get a room. So they didn't. It's not just because they didn't get a ventilator; they also could not get a room. And so some places are really overwhelmed. And then the other negative aspect is that the healthcare workers are not given safety materials. So they are reusing the same masks and the same gloves. So that means if I break my leg and have to go to the emergency room, and the people in the emergency room have just seen a COVID-19 patient, and then they come to me and they don't change their gloves, they can fix my leg, but the healthcare workers would end up transmitting the COVID-19 virus to me. And so that's happening because there has been lack of preparation, of course, here overall, and the healthcare workers are not getting the safety equipment that they need.
Yeah, it is something absolutely. It is the same thing that in France, where the nurse and even the doctor did not get enough material, security material for themselves. Yeah.
Yep.
Is Trump's announcement that any coronavirus patient coming to the hospital be treated without spending a single dollar effective, or is it an announcement effect?
So, like so many things that Trump says, that was not actually true. Now, it may be true later, but now it's not true. So what is happening is it looks like the testing for coronavirus is free. That's what it looks like.
Yeah,
It's like you do not have to pay for testing. But the insurance companies, who are the ones who pay for this, did not agree to make treatment free. Now, most people think the treatment will be free eventually, but right now it is not free.
It's not
which is very interesting because the United States is one of the few developed countries in the world that does not have universal health care. So when you go to the hospital to get treated, you get a bill, and the bill can be significant. So if someone has to spend several days in the hospital, to get treated for this, they could see a bill that is more than their annual salary. So if they make $40,000 or $50,000 a year, they can get a bill for $40,000 or $50,000. So this would be a tremendous leap forward if they were able to make sure that no one paid this. But it's what I find interesting here is that there are things that they're doing, the United States government, to help mitigate the crisis. They're not doing a good job, just to be clear, but all of the things they're doing to mitigate the crisis resemble some form of socialism. So they are now trying to make sure that no one has to pay for any hospital stays that have to deal with COVID. But that is universal health care, which of course is a socialist idea, even though it exists in non-socialist states. And that's something that now they're trying in order to prevent people from dying. So it's very interesting that they are implementing socialist ideas as a way of fighting the coronavirus instead of implementing market-based ideas.
Social ideology, but also just what it is written is in the International Covenant for Social, Economic, Cultural, and Environmental Rights.
Yes, yes. Well, those basic rights which should be
right to health and the right to not die.
Yes, except those rights are not recognized in the United States.
Yeah, sure. And what's happened when one patient victim of COVID-19 is coming to the hospital, but he has no insurance? What does it happen to him?
So they're supposed to be seen and then sent a bill, but it depends where they go. So this is the other thing, is that there's a public hospital where the person has to be seen and then they're sent a bill. And then there are private hospitals that don't have to see them. So the private hospitals can actually refuse to accept the patient. Just like if you go to a restaurant and you don't have any money, the restaurant can say, no, we don't want you to eat here. The hospital can say, no, we don't want you. And they can force them to leave or take them to a public hospital. And then they would be in debt really for the rest of their lives. And it would have things happen like they would take their money if the government tried to give them money, like is happening right now.
Therefore, do you know, or even the state knows exactly the number of deaths by coronavirus if there is some people can't get in the hospital and be treated at the hospital?
So this is a major problem. Right now, there is no national standard for monitoring and for recording deaths from the virus. So that means that if one person were to die in one state, they would be marked as a death for corona. But if they were to die in the next state over, they would not be marked as a death for coronavirus. So many hospitals do not have all of the testing kits or do not have enough. And so they're not testing people when they come in, even though they see the symptoms, or when they die, they're not testing them after they die because they need to get on to the next patient. So there's not a full accounting right now of everyone who is infected. And what's happening then on the other side is that we have people who are saying, well, they are just counting. So some states now are saying, if you have the symptoms and you came in and nothing else was wrong with you and you died, we are going to say you died of COVID-19. Of course, some people now are saying, see, they don't even know if the person had it. They're just marking it down even though they don't know. So that's inflating the numbers, when the reality is the numbers are decreased. It's not that many. But this is the fact that there's no standard for it is fueling conspiracy theories on all sides. And several states, including New York, had to revise their numbers upward because they're now adding cases that they said before they did not add. Now that they're using some kind of standard. So this is a very confusing thing. Their total jumped suddenly. The total of several states jumped suddenly when they decided to go by one standard, and there's no national standard, and there's not a national standard for recording deaths by race or by gender or by a number of other factors.
The question of difference between states, how the COVID-19 is analyzed and also treated, is important because from where we are in France, it appears that there are dissensions between certain governor and the White House about the COVID-19. What are the consequences of this dissension and difference between states also? What are the consequences for the most
Yes.
precarious and particularly people of African descent and Latinos, without forgetting all migrants.
Yes, this is the important question, I think. So what it means is that the way the society, your neighborhood, your city is responding to the crisis is very, very different depending on where you are. So in one area, they could be taking a lot of measures to help people to prevent the transmission, and in another area, they could prevent nothing. And it is widely considered that the White House is doing an absolutely incompetent job of responding to it. So the states are now forced to handle this themselves. And this raised a lot of problems. Number one is the federal government gave money to every state, the same amount. I don't remember the exact amount, but let's just say it was let's just say it was $5 million for each state to deal with COVID-19. Every state got the same, got $5 million. So that means New York, who has the highest number of cases in the United States, and the United States is the highest number in the world. So New York has the highest number in the United States, got the exact same amount of money as another state like Montana or Nebraska, which has virtually no cases because there's not a lot of people who live there. Not because it's not spreading, but because there's not a lot of people who live there. So in that instance, it means that the money that is left over to actually treat people and to help people is not a lot. They're not getting a lot of money per case. So I think the numbers were New York got $19,000 per case. And because it was the exact same amount of money, Montana got $300,000 per case.
Okay.
So there's a very big difference. That means people in New York are not getting the same quality of care because they don't have the same amount of resources that they're working with. So that's one. The second thing is that in some states, they are taking aggressive actions, which means people are being somewhat protected. So in Washington, D.C., for example, you are not allowed to go into a store unless you have a mask on. So that provides some level of, it's not perfect. They're not making masks available. I think masks should be made available to everyone, but they're not. So that means that people are being somewhat protected. In other places like Florida, however, they're doing nothing at all. Not only are they doing nothing, they want to start resuming having sporting events very soon. So that means people will come together, they'll be yelling and screaming and touching each other and sitting very close to each other. So this is going to be a major problem.
How the federal state and its services take into account the problem linked to the coronavirus, but also the other consequences of confinement, such as domestic violence, maternity, loss of employment, with the consequences of the explosion of requests for unemployment allowance, because I read more than 2,200% since the pre-coronavirus period, and the informal economy, security, access to money, among others.
Yes, so this is another area where we're seeing an extreme impact among lower income people and particularly immigrants here. So first of all, the support that is provided, like even the small check that the government gave or some of the unemployment services are not available to undocumented immigrants, which means they could be out of work and have no safety net whatsoever. So this is a major problem. There are several organizations, some of whom we work with here in the States, who predicted at the very beginning of this that this social isolation is going to cause a significant increase in domestic violence for women and for children. And that is exactly what has happened. And there's no real way that the state is responding to that. They're starting to document the numbers, we think, but they're not really responding in any significant way, to it. They are starting to release people from jail. They are not arresting people who are committing acts of domestic violence, not to the same numbers anyway, not saying no one has been arrested. And of course, they don't want to bring them into the jail, but also, they're also not then providing women somewhere else to go. And then this is made more difficult by the fact that then both parties, the abusive male and the woman who's being abused, neither one of them have any income, and they have to pay rent and they have to pay electricity and all those other things. So the lack of a social structure that can support human life then is making all of these problems that existed, domestic violence, violence against children, hunger, all these things are becoming much, much worse. It really is exposing the way the system is incapable of taking care of low-income people.
Take care of that.
And that problem is doubled for immigrants.
Do you think after the coronavirus seconds, the unemployment will change, or the people have lost their job will recover their job, or what do you think?
I think we're going to see a permanent shift downward of employment numbers and the type of employment that's going to happen, particularly because there is no national way of dealing with this. I think we're going to have some reductions in numbers, and that they're going to loosen things up and people are going to go back out, and then those numbers are going to go back up again. So I think many of the jobs are restaurants is an incredibly large industry in the United States as well as in France. But I think that industry is going to be changed forever.
Yeah.
It's just not going to operate in the same way, and those jobs that are associated with it are going to be lost forever as well. And it's not clear what we're going to do here. At the same time, the fact that people aren't traveling all the time back and forth has had some other impacts as well. The pollution in Los Angeles, which is one of the most polluted cities in the United States, has cleared up significantly. So there used to be a constant smog around Los Angeles, so you couldn't see all the way through the city in the sky because there's always a smog and all the traffic. Well, because so many people are staying home, the smog has almost completely disappeared. Not completely, but almost completely disappeared. So because of this, I think the question many of us should be asking is, when this is over, do we want to go back to the same numbers? Do we want to go back to the same thing? So ironically, this thing that is killing economies and killing some people might actually end up saving the earth if we can see at the end of this that we should not be treating the planet this way. Maybe we need to figure out some other way of doing things.
It is exactly the same thing for us. It is the first time in the sky during the night, the sky in Paris, you can watch stars, and lot of stars, not only one or two, but lot of stars.
Yes, we haven't seen stars here in Washington in forever. So yes.
Very interesting. What is the situation of elderly people in residential establishments?
In order to protect the elderly from being accidentally infected by their grandchildren or their children or their loved ones, they have been, the facilities have limited the ability for people to visit them. And while that's understandable for the visits, in order to stop the spread of the disease, what it means is that a lot of older people are being completely isolated. And that is a major problem in terms of their mental health. It also means that young people are not getting access to their elders, and that's also a problem for them. And I think in those places where there is abuse happening, elder abuse happening, then that means that those places have no supervision whatsoever. They don't have much supervision from the state, and now there's not even supervision from the family. So I think we're going to see the repercussions of these actions later. And I think it is important that we stop the spread by limiting interactions, but I think there also has to be some measures in place to protect the safety and the dignity of those who are there. So I think they have to make requirements that those places have video services available so that they can continue to meet with and see somehow their loved ones.
But do you have any clue about the number of contaminated and the number of deaths in this?
So I don't have the number of deaths in there, but in the early parts of the crisis in the United States, those were considered the hot spots. There were clusters in the Northeast, New Jersey, New York, and a couple of other cities where that was all of the cases, not all of them, but a significant number of cases were coming from these retirement communities.
Oh, from this establishment?
Yes, and what they were suspecting is that the children and grandchildren were going on vacation or going somewhere, and they'd come and visit, and then they would transmit it to one, and then everyone else in the facility would get it. And by the way, this is happening in the because they're in confined spaces and are living close to each other and talking to each other, and they don't have social distancing. So you can just imagine what's happening in the prisons in the United States. The United States has the largest prison system in the world. Inmates are getting infected all over in prisons and are dying in cells next to other inmates who are not provided then with equipment.
It is a good transition because, as you know, Mumia Abu Jamal is in jail in Frankville,
Yes.
Pennsylvania, and all the people are aware about his situation, health situation, because he's not good health, and also the possibility for him to be contaminated by other inmates.
Yep.
But he's not the only one. There is there is political prisoners still, Leonard Peltier and others, but also all around the world. And even in France, we have Georges Ibrahim Abdallah and a Basque, a Basque person from Basque country. And it is absolutely impossible to obtain for them the release even during the pandemic.
Yes.
In order to be saved and in a safe place. And after this pandemic, they can go back to cell, but it's absolutely impossible. It's like for the system, if it was treated as a treason, treason, yeah?
Treason.
Treason. And there is no reason to maintain these people in cell, but they prefer to have these people in cell rather than out.
Yep. At the time, it sees it as if the point is to be mean and to be cruel. That the point is to be as cruel as possible, because you're effectively giving a death sentence to a large number of these people. In the jails in Washington D.C., they stopped giving inmates soap.
Oh my God!
And this is the fundamental thing we need to stop.
Human treatment.
Yes, and that means you now have to buy your own soap. So those prisoners who do not have enough money then don't have access to basic things like soap.
There is one point we just approached very quickly. It's about the disparity on death. Could you tell us more and explain? We have the answer, but I think from your perspective, it's also very interesting for everybody to understand what is exactly in place in Occidental country, white world.
Sure. So let's go over some of the deaths happening in different cities. So Washington, D.C., as I mentioned, is 45% Black. But the deaths from coronavirus in Washington, D.C. are 56% Black. If you look at some other places in Michigan is a state where Detroit is in the United States. 14% of Michigan is Black. 33% of the cases are Black. In other words, 33% of people who have coronavirus. So that's twice the amount of people, Black people. We have double the rate for coronavirus cases, and 40% of the deaths. In some of the more extreme cases, in Chicago is 30% Black, but 68% of the deaths. And Louisiana is 33% Black and 70% of the deaths. So what we're seeing here is a disproportionate number of people of African descent, not who are getting it, although we're getting it disproportionately a little bit, but we are dying from COVID-19 at a way disproportionate rate from our numbers in the general society. So what's happening here? What's going on? So I think there's a couple of things. The main one is that the COVID-19 seems to have worse impacts for people who have certain pre-existing conditions, diabetes, who have trouble breathing generally, hypertension, all those, a number of other things. Obesity seems to be one, although they're not sure exactly what the connection is. I think the obesity causes hypertension and causes other things. So it's really those other items. But the important thing is that Black people of African descent, disproportionately have those pre-existing conditions. And a lot of those pre-existing conditions are directly related to poverty.
Yes.
Hypertension is related to diet. The breathing problems such as asthma and things like that are related to environment, places with a lot of smog and smoke and things like that. Even obesity is related to diet. If you can only have access to inexpensive foods that are really bad for you, all those things are related. So this is a way in which structural racism, structural inequality is adversely impacting us, even in the way we are relating to some virus that, of course, doesn't know the difference between black people and white people or poor people, etc. I think also if we were to look at the number of people in poverty, although they don't keep records that way, the numbers would be even more disproportionate than they are now for people who are black and poor versus people who are white and wealthy. So this is a significant problem that we're going to have to get a grip on, and just to me demonstrates that we don't have any power or control over our lives, because it means that our health is in someone else's hands in advance, and then our treatment once we get sick from the virus is also in someone else's hands, and um, we don't get the same aggressive treatments that a wealthy or whiter person might.
And what you mentioned with this rate of deaths for Black people is very interesting, because it confirms what Black Lives Matters try to make understandable to the American society. It's Black Lives Matter, Black life no matters, does
Yes.
not matters. And
Yeah.
that's a very big issue. And also it's interesting the link you made between poverty and death, because it's confirm also one thing we try to make understandable to everybody when we are working against structural and systemic racism. We cannot work on anti-racism just taking into account racialization.
Mm-hmm.
We need to interlink race and class.
Yes. And I would add, we also need to interlink gender.
And gender, yes.
Because,
so it was my third.
Yes,
It
because
was
of the
my third.
social constructs. Yes, that's exactly right.
Yes.
And I think women are getting hit much harder with this, certainly with the responsibilities for caring for people who are impacted, who can't go to the hospital, way over and above what
and it is very interesting because, for example, for the trade unionists working on the issue of racism, they take into account class, but not race. And it is something they have to change. It's really, if really they want to change the paradigm of racialization, they have to take in account what decolonial thinker put in place, the intersectionality between race, class, gender.
Yes, that's exactly right.
And the number of deaths in this particular pandemic proves it is important, the importance of this intersectionality.
Yep, I think that's exactly right.
Okay, could we go further?
Yes, please.
Okay. Regarding all what you said before, have organization or citizen groups start legal proceeding for infringement of the right to life for failure in the management of the pandemic?
So we're just starting to see that now, where organizations are saying, if this government agency or this person would have behaved differently, this number of lives would have been saved. And that person, therefore, is responsible for those lives. I think there's one lawsuit which has been filed, but there has not been many. And I think the reason there hasn't been many is in this time, particularly with Trump in the White House and all the things that means. I think most organizations think this is a bad time to bring up those lawsuits because there's literally zero chance of winning. I think the organizations that file them will face a lot of public scrutiny and attacks and even death threats, and it will further have no chance of winning in the courts. And therefore, what's the purpose of doing so? So there's a saying in here in the United States that what you don't want to do is make bad law, and you make bad law by pushing something that you know cannot win. And when you lose, then that loss becomes part of the law. And that makes it even worse. So I think that's what people are afraid of now, and are afraid that basically it would give blanket immunity to government officials for doing anything they want. So I don't think this has been a very aggressive area, and I don't think that it will be because of the time in which we find ourselves.
Okay. Okay. First, with the inaction of the federal state or the states services, what are the forms of non-state solidarity being put in place?
So I think this is some of the more interesting work that's happening right now. There is a number of organizations who are engaged in what they're calling mutual aid, where different communities support one another during this difficult time without depending on or having to go through the government. So right now, we're basically all on our own in terms of getting masks and gloves and food and different things like that. But now communities are starting to band together in at least some small ways and to say, let's all support each other. And if everyone picks up a little bit of weight, then we can make it through this thing. So that's where we are now. So there's a number of organizations that are engaged in mutual aid with their members and increasingly with other organizations. And that's happening mainly on the local level right now. Washington, D.C., for example, has a relatively big mutual aid, mutual support network where they're delivering food to people who are trapped inside the house. They're delivering cleaning supplies to people trapped inside the house, and they're doing so without asking for money. People who are volunteering or who are not working, who are just spending their time doing this and putting themselves at risk and providing their own masks and things like that. So this is happening, and this effort has been so successful, by the way, that a week ago, the mayor of Washington, D.C. announced a new hotline where people can call and they can get exactly this kind of support. And on the hotline, instead of pointing to government services, the hotline is providing you with the phone number to the mutual aid services in DC. So even the government is now trying to take credit without providing any money for the mutual aid work that's happening inside here, that's happening inside of civil society. This is amazing, incredible work, and very brave, by the way. And I think this is going to be a hint of what society could look like after this pandemic is over.
Yes, but in certain way, it's good. It's very good. There is mutual solidarity in this pandemic, yes. But also it just shows how the state are absolutely absent, and how the state is considering being or as being, not being, but non-being.
Yes.
And it's terrible because it's very, even if the mayor of Washington, D.C. provides a number of the mutual solidarity, but he has to do that. It is the duty of a city to take care of the jobless, precarious people.
What you would think the city would do is to actually take care of people. But instead of the city taking care of people, the city instead is saying, here's people who are doing it for free, and we're not even going to give them money, and we're not going to tell you their name, and we're not going to tell you that they're protesting the government. We're just going to, and we're not going to do it ourselves. We're just going to send you to them. So I think it's also showing that even the government is now having to depend on organizers instead of the other way around. But I do think you're right. The government is becoming more and more absent. I think that's going to happen more and more, and that means that we're going to have to rethink what it means to get basic supplies, what it means to provide each other with things. And I think that rethinking again will be the seed that will sprout out a new world.
Should be, yeah, in certain way, yeah.
Yeah.
What role do social movement and organizations such as yours and those with which the Frantz Fanon Foundation works on the issue of structural racism and reparation play?
So I think, of course, I think the center of the response has to be in social movements, not in government. And I think that even before identifying that governments are becoming more and more absent, I think this response has to be one of social movements. And the response of social movements has to be that we need to solve these problems of people eating, of people having some cleaning supplies, etc. But we need to solve them in a sustainable way.
Yeah.
not in a way that's going to cause more pollution or in a way that's going to lead to a few people becoming really wealthy and other people becoming poor. You know, we talked earlier about how all of these restaurants are going to go out of business. A lot of these small stores that are owned by middle class and other families are going to go out of business. I got to make it. But in the meantime, Amazon is hiring 150,000 new people. And some of the bigger, and it's reported that they are increasing their sales exponentially. So they are going to, the wealthiest people in the world are going to end up in a way better position at the end of this than they were before. So how do we solve this problem in a way that does not replicate that model, that doesn't leave the world with just a few billionaires and they're going to consolidate everything? It's really very difficult in the United States to get rubbing alcohol, hand sanitizer, or toilet paper that does not come from Amazon or from a couple of other places. There's only 4 or 5 places where you can really get it. The local stores no longer are able to get access to them because they're being hoarded by the big companies. So then how do we address that? And I think that happens through the social movements, through organizations that can think theoretically and in the future about what the world can and should look like. What is the nature of oppression and the nature of liberation? And I think that's what the Fanon Foundation can do, and I think that's one of the contributions it has to provide as well.
Absolutely, absolutely. Are there any action plan to denounce the arrogance and violence with which the most precarious are treated in a world the damned?
Yes, so there have been a lot of actions here in Washington. We've had every week now. We've had a caravan, of course, because it would be just difficult to have people protest next to each other. So instead, we're riding in cars and we're going in front of the jails demanding that the inmates be released. As I mentioned earlier, inmates in DC jails now are no longer getting soap provided to them during a pandemic, when they're telling you that the most important thing you can do is wash your hands. So we're saying we need to free them all. And so we've had these caravans go to jails, and we're honking and we're holding up traffic, and we're doing anything we can to bring attention to the damned here, to the people who are locked in a cage. And you know, during this time of social isolation, people are complaining that they can't go to their restaurant, or they can't go to the store, or they want to leave the house more. Imagine if you were in a cage, a 9-foot cage, for 23 hours a day, and you were in there either by yourself or with 2 or 3 other people, 2 or 3 people who you didn't know except for being locked in a cage with. This is not humane under any circumstances, but it's downright lethal. It's downright deadly during this type of pandemic. So there have been protests like that. There's also a major protest which is being planned for May 1st for International Workers' Day. And that is a general strike here in the United States, which hasn't happened in any significant way in a long time. But I think we're going to have a relatively small one this time, but I think that's going to build up over time, and I think we're going to see the growth of general strikes.
General strike everywhere, all around the United States, or just in Washington D.C.? This
will be around the United States, and it will be targeting certain industries with sick outs, with critical workers not going to work. Of course, this is not including hospitals, but the irony, of course, here is that the workers who are the lowest of the low for all this time, who really are the damned in terms of the working class, the people who stock the stores and pick vegetables and things like that, are now essential workers, and they have to go to work, and the entire society is depending on them, as some of us knew that it already did, but they were never given any respect in the society. So if we can get them to demonstrate their power in this way, then that would be great. And also, we're then asking people who are not in those positions, but who are consumers, to not go shopping on May 1st, not to buy anything. If you need to buy something, buy it before, but just to show the impact of that day, of saying we're making these deliberate efforts. So I think we're going to have some impact on that day, but I think it's going to just show us what our power can be, and that's going to, I think, lead to some more protests later. I think the difficulty is we are in a moment where we would see mass protests all around the world. We would see mass gatherings all around the world, but because of the particular nature of this pandemic, we cannot have mass gatherings.
Yeah, sure.
So the only ones having mass gatherings right now are the religious right wing and the ultra right wing, who are demanding an end to the social isolation.
The general strike on May 1st is organized by Afro-descent organization or Afro-American organization, or just by trade union?
So it is of course, significant numbers of trade unions are starting to join in, but the call for it was made by people of African descent, like Cooperation Jackson and several other big organizations that have a strong class analysis. And of course, a lot of labor groups now want to join in, and workers at some of these major facilities like Walmart and Amazon now want to participate and join. So there's going to be a significant amount of trade union participation. But the idea for this and the push for this really has come from people of African descent living in the confines of the United States.
Cooperation Jackson is based in Mississippi.
That's correct. Which is a very rural.
With Cali.
Yes, Kali Akuno. That's exactly right.
Okay.
Was the spokesperson.
Great. First, with all the information we have, which is fairly close to which we know in France, it's pretty the same situation. And faced with a large number of infected or dead people of African descent or African origin in Western countries, Occidental countries, white. We can only note that the black body does not count, just as it did not count during the transatlantic slave trade and during colonialism and enslavement. In times of economic difficulties, they are the first affected by unemployment and precariousness. During a pandemic, this body pays the heaviest price. Capitalists continue to view this body in a colonial way. Black body still do not count and are part of the non-being area. And Western states still have colonial management of black bodies. For your point of view, how do this type of management fit into an historical trajectory of the Western report from the white world to the refusal of otherness, of alterity?
So I think the analysis is exactly right, and that is the analysis taken by my organization, Pan-African Community Action, which is that we are people of African descent living in the United States, living in France, are a domestic colony. We are a colony inside of another country. We usually think of colonies as far away from the metropole, but here the colony, we're colony inside, and we are treated just like an internal colony. And I think what's happening here describes it perfectly, where we are disproportionately impacted by the crisis and less proportionately assisted in the way that we need. Even when they are providing us with some sort of assistance, it is not actually for us, it's for them. So I'll give you an example. California has had one of the worst home crisis of homelessness in the United States. And this has happened, it has exploded since the 1980s when the governor of California, Ronald Reagan, became president and passed a bunch of laws that made it easier really to become homeless. And since then, there's been a consistent effort to privatize the housing market and just make housing more expensive. It is now a major industry in the United States. So California has had an incredible explosion of homelessness there, and it's been devastating. And the state has seemed unable to solve the problem. They always are saying there's too many, we don't know what to do, we don't know how to fix it. In March of 2020, while the crisis was starting to ramp up and they were fearful about how bad it would get when the projections were getting the worse, the state of California started the process of getting hotel rooms for every single homeless person in the state of California, every one. And now just alone in the Bay Area, San Francisco and Oakland and San Jose, California, they have over 8,000 hotel rooms to house the 8,000 homeless people there. So almost overnight, within a couple of weeks, the demand that organizations have been making for years, the social movements have been making for years, house everyone, provide people with housing, almost overnight was suddenly provided to everyone. Now, every homeless person who wants a place to stay through the crisis now has a place to stay. How did this happen? The truth is they're not doing it for the homeless person. They're doing it because they don't want the homeless person to touch a door on a nice building that then the businessman the next day is going to touch. So they will not house us, poor Black people, because they think it's good for us. They will only house poor Black people if they think it will benefit wealthier people. And in the same way, during slavery, I'm sure there were some slaves who said, look how nice master is for us. He's giving us food every day. Well, the master was not giving us food because he wanted to be nice to us. He was giving us food because he wanted us to work more. And the only way we could work tomorrow was if we ate today. So this is the same thing that is happening right now. This is a historic continuation because even the things they do that on the surface look as if they are benefiting us are actually done entirely for their own benefit. Our bodies don't have meaning, and our lives don't have meaning outside of the meaning for them. And we have to have this. It's important that we have this analysis so we understand that this is not something that they're doing us some kind of favor, even when they do things such as give us a check for $1,000 or provide free treatment, which looks like it could happen in the United States. They're not doing that for us because they could provide us free treatment for cancer and for anything, but they're not doing that. They're only doing that because they know that the only way to protect themselves is to protect us, and they're doing that for them. They are not doing that for us.
And it is exactly, we can also make some comparison with the new free after enslavement have no other choice to work again for the slave master, and the slave master at this moment take care of their body, but just in order to get their work.
Yes, for the sole reason.
And to comfort the capitalism.
Yes, yes, that's exactly right.
Allow me to just recall in 2016 when I was a chair of the working group, if you remember, during the press conference after the country visit in the United States, I stressed that faced with the structural and systemic racism endured by African American and African descent, there was no alternative but to go through a political process of reparations. You remember that?
Yep.
In order to change the conditions that allow racial capitalism to continue its predatory and multifarious action in the North and in the global South, especially on Black people. Don't you think such a process should be really supported by people of African descent, Africans, and civil society if we want the day after the coronavirus to be different from the dominant model that kill all of us?
So I think this is, first of all, I think that report, many of us has used it over and over again to lend credence and legitimacy to the arguments that we were making in favor of reparations. But at the very beginning, when we started talking, I was saying that one thing that this virus is doing, this crisis is doing, is that it is exposing some of the limits of this system. And I think there's nowhere this is more important. There's probably not a bigger exposure than here. So among those who have not agreed up until this point with reparations have been people who say, well, you know, we're in the system and the system is helping us and we're helping it and we're all getting along, and this is great, and so there's no need for reparations for some kind of separate or other. But it seems pretty clear that if people of African descent had some kind of collective resource that we could use to care for ourselves instead of depending on those who don't seem interested in caring for us to do so, then we would be in a much better position in any number of ways. But this virus in particular, we would not have these disparate impacts, these disparate deaths where we're 30% of the population, but 70% of the deaths in some cities. That would not be happening if those 30% were in charge of their own health care. And that is fundamentally what reparations is about. It's putting us in a position where we can use those resources collectively, not individually, but collectively,
Absolutely.
so that we can solve some of our collective problems.
Mm.
I think this crisis, as it eases and as we start having conversations about how to avoid it, what we could have done differently, reparations will be, the lack of reparations will be one thing that this system exposes, and how we need reparations in order to prevent us from being in the same position the next time. And there will be a next time.
Yeah,
but reparations is going to be at the center of that.
True.
This is going to emerge. I'm predicting now that this crisis of 2020 will emerge as one of the significant justifications for reparations in the future.
Yeah,
I think
absolutely.
you're exactly right.
Absolutely. I have a last question for you. As your organization is a Pan-African Community Action, it's about Pan-Africanism. You know, there is a lot of people claiming for Pan-Africanism, and there is different kind of Pan-Africanism.
Mm-hmm.
But don't you think after this pandemic, the concept of Pan-Africanism could help us to build unity in Africa, and also maybe unity among diaspora, and not to divide the diaspora as it is now, and also maybe to go back to the fundamental principle of the first Pan-Africanism as it was think by Marcus Garvey and others, and
Yes.
not to this romanticization around Pan-Africanism. What do you think about that?
Yes, so I think the romanticization of Pan-Africanism into a cultural thing, where Pan-Africanism means that you're wearing a particular style of clothes, or you know a certain number of words in Swahili, then that becomes Pan-Africanism. I think is maybe it's acceptable when you have nothing else really to think about, but when you are thinking about when you have a major global pandemic that you're not able to respond to, then no one is thinking about if you have a stripe of kente cloth on you, or if you know certain words in Swahili. So we have to start thinking about things that are more strategic. Pan-Africanism is which is of course the liberation and unification of Africa under the economic system of socialism, is increasingly important now, as we see that the West is actively planning on testing medicines throughout Africa without, I'm sure without our consent, or at least without consent from the people who are being tested. Maybe the puppet heads of government would consent to it. And at the same time, on the other side, China is coming in and doing all kinds of exploitation of the continent as well. Not to mention the mistreatment of Africans in China itself. So I think there are people who are looking out for Americans. There are people who are looking out for the French. There are people who are looking out for Germans. There's no one looking out for the African. Who is looking out for the African? I don't mean just the continental African, but Africans in the diaspora as well. Yeah. So who's looking out for the African? And I think the answer is the Africans. And the only way the Africans can look out for the Africans is if we have a level of unity, and a level of functional unity, not an emotional or cultural unity, but a functional political and economic unity that allows us to respond to these crises in a way that right now we're not able to. Pan-Africanism is going to be the only way we can ensure that when the next crisis hits, that we're going to be able to come out of it alive and intact, that African people are. So we must move towards Pan-Africanism.
Sure, I'm totally agree. I totally agree. I think, Max, we have answer to all the questions. Thank you so much for that.
Yeah, thank you so much, and thank you to the foundation for all the work that you do.